You're sitting normally when suddenly, your eyelid starts twitching. You didn't tell it to move, and you can't seem to control it. So why does this tiny flutter appear out of nowhere, and could your body be trying to tell you something?
Surprisingly, it isn't your eyeball that's jumping. That tiny flutter usually comes from involuntary contractions in the muscles around your eyelid. But what makes those muscles suddenly start contracting in the first place? Sometimes the trigger begins the night before. When you don't get enough sleep, fatigue can make an eyelid twitch more likely. Those tiny muscles and the nerves controlling them may become more irritable, and suddenly, that annoying little flutter appears. Your morning coffee could be another clue. Caffeine stimulates your nervous system, and having too much may increase muscle and nerve excitability. For some people, that extra stimulation can show up in a surprisingly tiny place, the eyelid.
Then there's stress, one of the most common triggers people overlook. When your body stays tense and your nervous system is on high alert, small muscles can become more prone to involuntary movements. And sometimes, your eyelid is where that tension decides to show itself.
Hours of staring at a screen can also play a part. When we concentrate on phones or computers, we tend to blink less, which can contribute to eye dryness and fatigue. That extra strain may make an annoying eyelid twitch more likely to appear.
Sometimes the problem starts right on the surface of your eye. When your eyes become dry or irritated, the normal tear film can become unstable. That irritation may increase blinking and can sometimes accompany or contribute to those stubborn little eyelid twitches.
Dryness isn't the only thing that can irritate your eyes. Allergies, dust, wind, or other irritants can make you blink more and leave the eye uncomfortable. In some people, that irritation may occur alongside an eyelid twitch or make an existing one feel even more noticeable. And here's what makes an eyelid twitch so frustrating: it may disappear before you can even check it, then suddenly return later. These tiny contractions can come and go for a while, especially when the trigger, like fatigue or stress, is still hanging around. Here's the reassuring part. The common eyelid twitch, often called eyelid myokymia, is usually harmless and temporary. It often settles on its own. But not every twitch should simply be ignored, because certain changes can tell a very different story. So what can you actually do about it? Start with something simple: rest. If fatigue is contributing to the twitch, getting consistent, adequate sleep may help settle it. Giving your eyes and your body time to recover can sometimes make that persistent flutter less noticeable. If coffee or other caffeinated drinks have become a big part of your day, consider cutting back, especially if you notice more twitching after having them. Reducing excessive caffeine may decrease that extra nervous system stimulation and help some people experience fewer eyelid flutters. If screens seem to make the twitch worse, give your eyes regular breaks. Look away from the screen, focus on something farther away, and remember to blink normally. These simple habits can reduce digital eye strain and help prevent the dryness that may be adding to the irritation. Here's another simple step that can feel surprisingly soothing: a warm compress over closed eyes. The warmth can relax the eyelid area and may also support the oil glands that help keep tears from evaporating too quickly. If dryness or irritation is contributing, that extra comfort may help. When that tiny twitch becomes annoying, rubbing your eye can feel almost automatic, but frequent or forceful rubbing may add even more irritation, especially if your eyes are already dry or sensitive. Instead, give the eye a moment to rest and let the irritation settle. But what if it stops behaving like a simple little twitch? If the spasms persist, repeatedly close your eye, spread to other parts of your face, or come with redness, swelling, discharge, pain, drooping, or vision changes, it's time to get medical advice. A twitch that stays in one small part of the eyelid is very different from spasms that begin involving other muscles on the same side of the face. That pattern can have other causes and deserves medical evaluation rather than simply assuming it's stress or caffeine. So if it spreads, I should get it checked. So what happens if you get it checked? A healthcare professional may ask how long the twitch has lasted, what seems to trigger it, and whether other symptoms are present. They can examine your eye, eyelid, and facial movements and decide whether anything further is actually needed. Everything looks normal. That's a relief.
For most everyday eyelid twitches, the basics matter more than you might think. Get enough sleep, manage stress, avoid excessive caffeine, take breaks from prolonged screen use, and pay attention to dryness or irritation. Sometimes, several small changes together make the biggest difference.
So the next time your eyelid suddenly starts fluttering, remember it's often a tiny, temporary muscle contraction linked with everyday triggers like fatigue, stress, caffeine, or eye irritation. Usually it settles on its own, but if the pattern changes or other symptoms appear, Don't ignore what your body is telling you. Your body gives you little clues every day, and understanding them can make a big difference. If you found this helpful, like, share, and subscribe to Health Glow Secrets for more simple explanations about what's happening inside your body.